I'm Roger Baker, Executive Director of the Stratfor Center for Applied Geopolitics at RANE, a global center of excellence for geopolitical intelligence and analysis. Learn how you can put geopolitics to work for your organization at ranenetwork.com.
Welcome to the Beyond COVID podcast from RANE Network. In this podcast series, David Lawrence, the founder of RANE, speaks with Dr. Fred Southwick, an infectious disease specialist at the University of Florida's College of Medicine, and Dr. Bill Lang, an expert in public health responses to biological incidents about the infectious disease landscape.
Bill and Fred, thank you again for joining us and giving us, hopefully, an update of what we should be concerned about and what we need not be concerned about. We've had a number of inquiries about the bird flu and cattle and what's happening, and the fact that it appears that the U.S. government is stockpiling some vaccines. Maybe you can help us think about that, those particular issues.
David, the big concern with any type of flu vaccine is what we know from the standard flu, is that for a vaccine to be maximally effective, it needs to be tuned very closely to the circulating variant. What we know about bird flu right now is that, yes, bird flu is out there. And in fact, bird flu is always out there. And we know that bird flu has infected some humans, but it has not created a situation of sustained human-to-human transmission. So whatever bird flu variant that's out there is not likely at this point a pandemic or even epidemic version. So if there is a vaccine that we have, the best is that it could blunt the initial phases of a human-to-human transmission, but it's not going to be perfect. But fortunately, we do have messenger RNA vaccines that could likely be created fairly quickly, but we won't know until that happens, and there's no real way to get prepared before something happens.
David, the cases so far have all been from animal to human, and there's been no human to human. And the latest outbreak in Colorado was workers working with chickens where it was too hot to wear the protective clothing and masks. And that's the reason that there was this, I think it was 8 or 9 cases showed up all of a sudden. That was really because they didn't wear the protective equipment that was required to prevent that animal to human spread. But as my understanding is that the cases have been relatively mild, that the virus is not really very effective in causing human infection at this point. But there's always the danger of a recombination event where one influenza virus transmits part of its genetic code to the bird flu and making it more adaptive to humans. That has not happened, but that is the concern, and I think that's why the government is stockpiling.
Fair to say that at least as of now, nothing's keeping you up at night concerning these reports.
So far we're okay, but you never know with infectious diseases.
Okay, fair enough, Fred, but certainly there's no reason at present date to be alarmed about these isolated reports. So let me ask you guys, it's been a number of weeks since we last spoke. What, if anything, is keeping you up at night?
I think for me, from an infectious disease standpoint, what keeps me up a bit is these major worldwide gatherings, specifically the Olympics. And while we're simultaneously seeing a little bit of uptick in COVID. Now, I say that scares me a little bit, but the COVID that we're seeing is not causing significant disease. Lots of people are getting it, but we're not seeing lots of hospitalizations. You'll see reports that there's still 1,700 COVID deaths a week. Well, that's worldwide. To put that in perspective, we see on average 2,000 influenza deaths per day globally. So the number of COVID deaths is not high, but still, with these large gatherings, it does bear watching. And in many ways, what keeps me up is not so much the direct effect of COVID, but how people are going to react to it. My big feeling is that people should be thinking of COVID right now much like they do flu, meaning if you get sick, stay away from people. Do the things you need to do to prevent respiratory disease, just like you do or should do every fall. But you don't need to get real spun up about this at this point. We need to watch it, but I don't see any reason that people need to be changing their behaviors beyond the way they would change their behaviors during flu season.
Yeah, I'm worried a little bit, Bill, for the elderly. This strain are a variant of the Omicron, and the good news is they do not seem to be any more virulent or cause any more severe disease than any other of the strains. But there have been a few changes in the surface protein that make them able to bypass the vaccine protection. And so that people are contracting that infection. And in looking at comparing the virulence, there are still significant number of mortalities in those that are elderly and those that have underlying disease. So I think we shouldn't let our guard down completely. And as Bill said, if you're sick, you shouldn't go into the public, or if you are going to go, wear a mask, and that should be protective. And I saw the latest guideline. There are, by the way, the CDC is following the sewage levels of COVID, and they have gone up in all regions of the country. Highest in the West, somewhat, and next in line is the South. And our president has actually contracted the virus just recently, and he's started on Paxlovid right away, which is the right thing to do for anybody over the age of 65, because I still think there is some risk of hospitalization and of death.
Yeah, I think you put that exactly right. And that's when I said most people, I agree that people, you need to be careful if you have risk factors yourself, or importantly, if you're going to be around somebody with risk factors. For example, I had somebody that I work with closely who had basically sniffles, felt fine, but a little bit of a cold symptoms, got tested and was instantly positive. The only reason she got tested was she was going to visit her mother-in-law, who was not real healthy. And sure enough, she had COVID. So it is out there. So have a low threshold for testing if you are yourself at risk, or if you're going to be around people who are at risk. And the going back to the sewage data, it was specifically the far west, so California and Oregon had high SARS-CoV-2 virus rates in sewage. Also South Central, primarily Texas and Oklahoma, and Florida. But the levels, all of these levels are nowhere near where they were 2 years ago, but they're higher than they have been over the last 12 to 18 months. In Europe, and this is relevant to the Olympics, the European CDC is still trying to track COVID. Now, tracking COVID is very difficult, but at least they can get they track COVID positivity in respiratory disease, and they saw a noticeable but not high peak in the early to mid-June. Well, that corresponded to the European Cup in soccer, and now it's back down again. So that's why there's many questions about, okay, so what's going to happen specifically in Paris and the environs with all the people who are coming in for the Olympics, and are they in fact going to be will they need to put in any types of controls for the Olympics as they have for other sporting events in Europe, specifically the Tour de France, where they required anybody who was around the athletes to wear a mask. Might those types of requirements come up for the Olympics? We'll see.
David, Bill made an important point, I think, that I would recommend for the business world. And that is everyone should have available the COVID-19 antigen test. If your symptoms have resolved, but your antigen test is still positive, the CDC recommends that you can go into work, but you should wear a mask during that period until the antigen is negative.
What should people be doing in terms of vaccines? What are you advising your clients, and is there different advice depending upon medical history, age, etc.? Because at least anecdotally, I will tell you, many people around here in the greater New York area have come down with COVID, and their families, their kids, and we had scheduled this podcast well before the news came out that the president has been reinfected. So what should people be doing, and what should institutions be advising their people to do, particularly around getting boosters and that kind of thing?
I think a major consideration should be the people who have significant risk factors. I still think that being the most up-to-date vaccine is not a bad idea. These are mainly going to be older people and people with multiple other disease processes. I think they should be giving significant consideration to being up to date on the vaccine. For other people, I haven't for many months been pushing hard on the vaccine. We look at President Biden. This morning they said he's had the vaccine 5 times, and yet he still got it. Now, of course, he is in the older population, and his immune system is probably not responding to the vaccine as much as a younger person would. But I still think that that definitely people who are older, have risk factors, should get the vaccine. For others, I'm not as convinced, because I'm not as convinced the vaccine is playing that big a role at this point.
I agree with Bill on his recommendation. The problem right now is the vaccine that we have does not really address the very newest variants. And the other problem is most people got vaccinated about 5 to 6 months ago, and we know that the vaccine immunity wanes significantly, at least antibody levels wane significantly after about 3 to 4 months. So the question comes up, if someone is elderly, potentially at risk, should they get the old vaccine now, or should they wait until the fall when there is going to be a newer vaccine that actually does address some of the changes in the current strains? I don't know, Bill, what would you recommend as far as that goes?
I think I would lean towards the waiting until the fall, and then rethinking. And we'll have more data by then. But even as we see with President Biden again, okay, so he's positive, but when people asked him how's he feeling, and he said, "I feel fine." That's what I'm seeing as people are getting this, and even older, if they have been vaccinated, especially if they have had COVID, they're doing pretty well with it. But just as we get with flu, the older you get, the more risk you have of having a significant problem, and it's not predictable who is and who is not.
All right, the ultimate question, of course, without revealing your respective ages, which would violate all sorts of rules of propriety, what do you plan to do yourself, Bill, Fred?
I plan to get the vaccine in the fall. If I were to pick up the SARS-CoV-2 again, I would definitely take Paxlovid, as the president has done. And that's the other key recommendation. If you're antigen positive, you're over age 65, or you have underlying disease, Paxlovid really is a benefit. Interestingly, I just saw today that they actually did a trial of using Paxlovid as prophylaxis. In other words, if one member of your household gets COVID-19 and you don't have it yet, and you take Paxlovid, will that prevent you from contracting it? As I personally experienced, the trial shows no benefit. So you cannot use Paxlovid as preventative care. It will not help.
Brett, I thought you were going to say that there was a new study because that did show benefit. Because there was a study about it. Time flies. It was about a year ago now that also showed no benefit. So yes, so the repeat study is confirming what we know, that unlike the flu antivirals that do have benefit for prophylaxis, for post-exposure prophylaxis. It does not appear that Paxlovid has any post-exposure prophylaxis benefit. What I'm doing for patients is, if they're a household contact of somebody with COVID and they are in a risk group, I'm saying, you get the first sniffle, you start testing, and I have a very, very low threshold for putting them on it as soon as they have a positive test, even if they're minimally symptomatic.
I think that's the wisest approach. I agree exactly with Bill on that.
As always, guys, extraordinarily helpful in the last minute or two. Again, I'm responding to inquiries that we get. Any updates around the safety, efficacy of the vaccine itself? Obviously, it's been in circulation an even longer time. More people have received it. Any data points that you think are relevant?
Bill, I have not heard of any serious new side effects or any problems with the mRNA vaccines.
I haven't heard anything new. In fact, I haven't heard much of anything, which is interesting, and this is continuing to look. We do know at the height of the vaccination time, there were reports of potential autoimmune issues associated with the vaccine. Well, that happens with every vaccine, and we saw more of those reports because the vaccine was being so broadly administered all at the same time. So is there a risk? Well, yes, but there's a risk with every vaccine. At the time, was the risk of disease higher than the risk of the vaccine? Undoubtedly. Now, I don't think we have enough to say for sure, but what that means is that the risks on both sides have become much, much lower, except for those people who are at high risk, and those people I don't want to take a chance with.
Yeah, one of the things that we've talked about before, which is really emphasized at this period, is when you have mass vaccination. In other words, millions of people are getting the vaccine at the same time. Those people, when they weren't getting vaccine, were getting specific autoimmune diseases, other complications, and they weren't attributed to the vaccine because you weren't getting the vaccine. But now those same events are being blamed on the vaccine, and that's where a very sophisticated statistical analysis is required to differentiate the background illnesses versus a true side effect from the vaccine. And now that we're not using it very much, there haven't been any of those events that can be blamed on the vaccine.
I want to thank you both again for not only great updates, but helping to give people the advice and counsel that they need to navigate the current environment. Hopefully everything will stay reasonably calm through the rest of the summer. And if anything comes up, we'll reach out to you and we'll get back on a podcast. Bill, I know you're heading to the Olympics, so travel safely. Notwithstanding the mayor of Paris, stay out of the Seine River.
Yes, I don't plan on swimming.
and Fred, your book about playing with bees and how the hive, of hundreds of thousands of years of the hive, can instruct a better healthcare system and mechanism. I know the book continues to do very well, and I've actually encountered a number of doctors who had read the book but didn't know we knew each other. So
great.
I'll pass on those kudos.
Excellent.
And hopefully
Thank you.
Continued success. All right, guys, thanks so much and really
Thank you,
appreciate
David.
it. All right, take good care.
Thanks, David.
This is the RANE Insights podcast, which is part of the RANE Insights series, comprised of both virtual and real-world events offering unique practical perspectives from RANE's leading experts in risk management. To learn more, please visit us at ranenetwork.com. That's RANE network.com. Thank you for listening.